Dogs can have diabetes exactly like human beings. Many pet owners are unaware of this reality and may be missing important signs that their companions are sending every day. Canine diabetes is a serious condition that affects thousands of pets around the world, but the good news is that with adequate knowledge and proper care, it is possible to provide a full and healthy life for your four-legged friend. Let's explore together everything you need to know about diabetes in dogs, from the first signs to forms of prevention and treatment. Understanding this condition can literally save your pet's life. And here on the Dr. Doug the Dog channel, you always find accurate and updated information to better care for your companion. Prepare to discover symptoms that may be going unnoticed, learn about the most common causes, and learn how to act preventively. At the end of this content, you will have all the necessary tools to protect your dog and ensure that he lives with quality and well-being. Let's go. Topic number 1. Why dogs develop diabetes. Diabetes in dogs occurs when the pancreas cannot produce enough insulin, or when the body does not respond adequately to this essential hormone. Let's discuss the main causes that lead to this condition, so you can better understand the risk factors involved. Genetics plays a fundamental role in the development of canine diabetes. Some breeds have a natural predisposition to this condition, including poodles, schnauzers, beagles, labradors, cocker spaniels, and dachshunds. If your dog belongs to one of these breeds, attention should be doubled, especially after 6 years of age. Obesity represents another crucial factor in the development of the disease. Dogs with excess weight have greater difficulty processing blood sugar, overloading the pancreas over time. Inadequate feeding, rich in sugars and refined carbohydrates, combined with sedentary lifestyle, creates a perfect environment for the emergence of diabetes. Hormonal diseases like hypothyroidism and Cushing's syndrome can also trigger diabetes. The modern lifestyle of pets, with excess caloric treats and lack of regular exercise, contributes significantly to the increase in cases. The lack of feeding routine, with irregular schedules and inadequate portions, also represents a considerable risk that many pet owners underestimate. Topic 2. Most common symptoms. Recognizing the signs of diabetes in dogs can make all the difference in early diagnosis and treatment success. Let's explore the most frequent symptoms you should observe in your pet's daily behavior. The first sign that usually draws attention is the excessive increase in thirst and urinary frequency. Your dog may start drinking water compulsively and need to go out to relieve himself much more frequently than normal. This symptom arises because the body tries to eliminate excess glucose through urine, causing constant dehydration. Another paradoxical symptom is increased appetite accompanied by weight loss. The diabetic dog may show insatiable hunger, but even eating more, continues losing weight progressively. This happens because cells cannot absorb glucose adequately, forcing the body to break down fat and muscle to obtain energy. Excessive fatigue and sleepiness are also important signs. Dogs that were previously active may become apathetic and prefer sleeping to playing. Recurrent infections, especially of skin and urinary tract, indicate that the immune system is compromised due to high blood sugar levels. Changes in the eyes, such as cataract development, can occur rapidly in diabetic dogs. Observe if your pet's eyes are becoming opaque or whitish, as this may be a late but very characteristic sign of the disease. Topic number 3. How to confirm diabetes diagnosis. Correct diagnosis of canine diabetes requires specialized professional evaluation and should never be made based solely on home observation. Let's explain how veterinarians confirm this condition and why technical monitoring is indispensable. The veterinarian will perform blood tests to measure glucose levels, which in diabetic dogs are usually persistently elevated. Normal blood glucose values in dogs range between 80 and 120 milligrams per deciliter, while diabetic dogs may present values above 200 milligrams per deciliter. Urine examination is also fundamental as it reveals the presence of glucose and ketones. Under normal conditions, urine should not contain glucose, but in diabetes, excess blood sugar ends up being eliminated by the kidneys. The presence of ketones indicates that the body is breaking down fat to obtain energy, signaling a more advanced stage of the disease. Some pet owners try to use human glucose meters on their pets, but this can lead to mistaken interpretations and dangerous decisions. Reference values and collection methods are different between species, and only veterinary professionals can correctly interpret results and establish adequate treatment protocols. Early diagnosis is crucial because it allows treatment to begin before serious complications develop. Therefore, regular exams and preventive consultations are investments in your companion's health and longevity. Topic 4. Treatment and control. Treatment of canine diabetes requires dedication, discipline, and constant monitoring. But with adequate care, diabetic dogs can live long and happy lives. Let's discuss how management of this condition works on a daily basis. Insulin is the fundamental pillar of treatment for most diabetic dogs. Unlike humans who may have type 2 diabetes treatable only with oral medications, dogs generally develop type 1 diabetes, requiring daily insulin injections. The veterinarian will determine the specific type of insulin, dosage, and frequency of applications, which normally happen twice a day. Controlled feeding is equally important in disease management. Diabetic dogs need specific diets, rich in fiber and with low simple sugar content. Mealtimes must be rigorously maintained, generally coinciding with insulin applications to optimize glycemic control. Therapeutic foods for diabetic dogs are specially formulated to help control blood glucose. These diets promote slower carbohydrate absorption, avoiding blood sugar spikes and facilitating insulin action. Constant monitoring through regular exams allows treatment adjustment as necessary. The pet owner plays a fundamental role in this process, observing symptoms, maintaining routines, and administering medications at correct times. Discipline and attentive observation are key elements for long-term treatment success. Topic number 5. Daily care and prevention. Prevention of canine diabetes and daily management of already diagnosed dogs involve simple but consistent changes in routine. Let's explore the most effective strategies to keep your pet healthy and prevent complications. Maintaining ideal weight is fundamental both for prevention and diabetes control. Regular exercises appropriate to the dog's age and physical condition help improve insulin sensitivity and maintain stable blood glucose. Daily walks, games, and moderate physical activities are excellent allies in disease control. Feeding must be rigorously controlled, avoiding caloric treats and foods inadequate for diabetic dogs. Many pet owners make the mistake of offering food scraps or sugary treats, which can completely destabilize glycemic control. Always prefer treats specific for diabetic dogs or consult your veterinarian about safe options. Routine is absolutely crucial in diabetes management. Fixed schedules for feeding, medication, and exercise help the dog's body adapt and respond better to treatment. Sudden changes in routine can cause dangerous fluctuations in blood sugar levels. Preventive veterinary monitoring gains special importance in dogs over 6 years of age, especially in predisposed breeds. Annual or semi-annual exams can detect early changes in glucose levels, allowing interventions before the disease manifests completely. Investing in prevention is always more effective and less costly than treating advanced complications. Topic 6. When diabetes is not treated. The consequences of untreated diabetes in dogs are serious and progressive, but our intention here is to raise awareness about the importance of adequate care, not cause unnecessary panic. Let's explain what can happen when the disease does not receive appropriate attention. Blindness caused by diabetic cataract is one of the most common and visible complications. High blood glucose levels alter the structure of the eye lens, causing progressive opacity that can lead to total vision loss. Although this condition is irreversible, blind dogs can adapt well to the family environment with adequate support from pet owners. Recurrent infections become increasingly frequent and difficult to treat as the immune system weakens. Skin, ear, and urinary tract infections can become chronic and resistant to conventional treatments. Elevated blood sugar creates a favorable environment for bacteria and fungi growth. Diabetic ketoacidosis represents the most serious and potentially fatal complication. This condition arises when the body, unable to use glucose adequately, begins breaking down fat at an accelerated rate, producing toxic substances called ketones. Symptoms include vomiting, diarrhea, altered breathing, and extreme lethargy. Early detection and adequate treatment can prevent all these complications. Well-cared-for diabetic dogs can live years with excellent quality of life, so knowledge and quick action make all the difference in the disease prognosis. Yes, dogs can have diabetes, but now you possess the necessary knowledge to make all the difference in your companion's life. Canine diabetes is not a sentence of suffering when diagnosed early and treated with dedication and love. Returning to our initial conversation, you discovered that recognizing symptoms like excessive thirst, increased appetite with weight loss, fatigue, and frequent infections can save your pet's life. You also learned that factors like genetics, obesity, and inadequate feeding contribute to disease development, but that prevention through regular exercise, balanced feeding, and veterinary monitoring can make all the difference. Professional diagnosis is irreplaceable, and treatment with insulin-controlled diet and disciplined routine allows diabetic dogs to live fully. Serious complications arise only when the disease is neglected, but with adequate care, your friend can have happy years ahead. Always remember that your dog depends entirely on you to recognize problem signs and seek professional help. Attentive observation, unconditional love, and preventive care are the greatest gifts you can offer your companion. Continue following the Dr. Doug the Dog channel for more valuable information about pet health, and remember that observing, caring, and loving are the keys to a long and healthy life alongside your best friend.